Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Nasal glioma. So here, this is a portion. It is a portion that is nipped off the encephalocele. So this is a portion and it is nipped off the encephalocele. So it is nipped off the encephalocele during the embryological development, during ED, that is embryological development. Then comes 60%. The 60% of it is extranasal. So 60% is going to be extranasal, and 30%, if you see, it will be intranasal. So 60% is extranasal, 30% is intranasal, then 10%, if you see, this 10% is going to be intra as well as extranasal. Intra plus extranasal. Now, where are they usually present? It is present as firm. So it presents as firm. Next is, it is subcutaneous swelling. It is subcutaneous swelling and it causes the nasal obstruction. There is the Furstenberg test which is performed. Furstenberg test. So this test is going to be negative. So Furstenberg negative, and the CT will reveal the bony details. CT will have bony details. Then comes the MRI. MRI will show soft tissue. MRI shows soft tissue details. Now the communication. How does it communicate? So when you look at the communication, there is communication with the cranial cavity. The communication with the cranial cavity. This is cut off. So communication to the cranial cavity is cut off. So there is no CSF leak. To learn and grow daily like this, please do subscribe.